Hello, my name is Janet Benedict, and I'm a student at Colorado Mesa University. The aim of this presentation is to provide information about the nursing specialty that's called Sexual Assault Nurse Examiner. It's a forensic nurse specialty. My nurse shadow happens to be the SANE coordinator for Mesa County. I'll begin by telling you what the responsibilities of a SANE nurse are. SANE nurses take care of sexual assault victims, and sometimes they take care of the perpetrators also. They meet a healthcare demand that we don't usually think about. These nurses have to consider the whole patient as they care for them. SANE nurses get called into work by law enforcement, usually from the ER, but they also work at other sites as well. They all work independently and mostly from home. And as I stated before, sometimes they're required to evaluate the perpetrator along with the victim. But you're not supposed to call them a victim, you're supposed to call them patients in order to be considered unbiased when you go to court. The first thing that SANE nurses do is obtain consent, and this can take a very long time because the patient is usually very emotional. They explain what the rights are that the patient has and the choices that they have to make. They explain in detail what the SANE exam, looks like. Patients have the right to stop the exam at any time and to not include all of the steps of the exam if they choose not to. SANE nurses engage in a lot of patient education. Everyone has the right to a SANE exam, even if they're not going to press charges. And then if they're not, the records are kept for 2 years just in case they decide that they want to press charges at a later date. SANE nurses have to find a balance because this field involves medical interventions as well as forensic or legal interventions. They have to be very flexible. They have to provide privacy and always protect their patient's dignity. The legal aspect involves paying very close attention to details as they evaluate the patient and collect evidence. It is important to not disturb the evidence, which is why the patient is not allowed to eat, drink, or shower, and they need to wait to void if possible. Their clothes are kept as evidence, and so alternate clothes are provided for after the exam. The SANE exam is quite comprehensive, and it includes a detailed health history along with a head-to-toe assessment. It also includes a comprehensive exam of the genitalia. Evidence is collected throughout the exam and consists of swabs for DNA and swabs to test for STDs. They save the clothing. Pictures are taken. A SANE nurse must maintain the custody of the evidence until it can be handed over to law enforcement. Nurses are required to maintain a chart for each patient, and it's kept at the Children's Center here in Grand Junction. It's imperative that they maintain HIPAA standards. They provide referrals as needed and treat any minor wounds. Most of the wounds they see are minor, but if they're not, then they are referred to the ER. The swabs that they collect have to be dried with a special dryer as mold and bacteria degrade the DNA and destroy it. During the SANE exam, SANE nurses give medications prophylactically, which include Plan B contraception. They also give Rocephin and azithromycin to treat for the possibility that the patient has been exposed to gonorrhea or chlamydia. These are the two most common STDs seen in Mesa County. They're then referred for more testing in 7 weeks, and it's explained to them that the medications that they've been given are not definitive and they are only prophylactic. important for SANE nurses to assess for the need for referrals when they discharge a patient. One of the most important items to make sure of is that the patient has a safe place to go when they leave. Some of the sources for referral would be the ER, the Victims Advocacy Treatment Center, law enforcement, counseling, and the Women's Center. It's crucial for SANE nurses to be open-minded and flexible as every case is different. SANE nurses are required to have more education. The certifying board is the International Association of Forensic Nursing, and they require didactic and classroom time. The minimum requirement is an ADN, and they are required to have 40 hours of classroom or didactic for adult and adolescent, and also 60 hours for pediatrics. Clinical experience is also required, and this consists of 24 hours of courtroom experience and 24 hours of practicing pelvic exams and interviewing, and you can accomplish this by spending time in the ER or at an OBGYN office. Once all of the training and clinicals are finished, the requirement is that the new trainee follow a SANE nurse around for a minimum of 6 to 12 months. Once you're on your own, well, you can't be on your own for at least 6 months, and you also must have performed at least 6 adult and adolescent exams and 10 pediatric ones. SANE nurses are required to attend lots of meetings. They go to peer review meetings, SANE meetings, case review meetings, and many others also. The International Association of Forensic Nursing requires that you have 300 hours of continuing education within 3 years, and the Advocacy Center requires 8 hours of CEs within 2 years. SANE nurses must be prepared to present their evidence that they collected in court and are required to serve as an expert witness. SANE nursing is unique in that it really does require quite a bit more education. In other words, a nurse can't become a SANE nurse just by spending time with other SANE nurses. SANE nurses work quite autonomously, and they work under an MD advisor. They always give one-to-one patient care. They work with a variety of other disciplines like law enforcement, social workers, and of course other medical personnel. They work in the ER, but they also work at other sites. They don't really know where they're going to be or when they're going to be there because they work on call. SANE nurses get paid per exam, and they get paid for the hours that they're on call. Each exam takes about 4 to 6 hours, and they average about 6 to 7 exams in a week. If you're looking to make money, this is probably not the specialty that you want to go into. The biggest difficulty faced by SANE nurses has to do with the psychological aspect of it. The crimes are violent, emotional, sometimes very tragic, and very awkward. My nurse shadow described how difficult it is to discuss some topics with very young patients, as some of them don't even know what a douche is, and they definitely don't like to say the word vagina. Some other difficulties that they face are that there really aren't very many of them. The training is time consuming and expensive. Most SANE nurses have other jobs, and one exam takes 4 to 6 hours. So juggling family and those other jobs can be very challenging. They then have to incorporate court time into all of that also. SANE nursing is a relatively new specialty, and they are still working the kinks out. Sometimes it can be a disappointment when the outcome is not what was expected or what was hoped for. It's important to try to focus and keep your perspective, as the role of the nurse is to collect evidence and be a nurse, not to prosecute anyone, just to get the patient on the road to recovery. The main way that SANE nurses improve the health of the community is through education, mainly through prevention. They teach classes and their patients how to prevent STDs. They teach what a healthy relationship should look like. They teach what sexual consent really means, as I guess a lot of young men don't seem to know what that is. They ensure that immunizations are up to date. They participate in structured organizational events also. The majority of their patients are CMU students. CMU actually has its own sexual assault team called SART, and they have meetings, and recently they showed a video of called The Hunting Ground, and this video is created by a couple of students to get the message out about how sexual assault has become a major problem nationwide in universities. The CMU Maverick Guide has a lot of guidelines and expectations that they have for their students as far as behavior related to sexual assault. Also, there is a law called the Title IX that was enacted to attempt to discourage sexual assault activities on campus, and also to encourage universities to take action against it. The Grand Junction Police Department also puts on educational events. The SANE nurse says that perpetrators are lazy and will go after the easiest victim. She also says that if prevention is aimed at the perpetrators, it will shift the blame back to them instead of to the victim, as people like to say things like, she shouldn't have been wearing that, or she shouldn't have been there. It's important not to blame the victim. And the other piece of advice that she gives everyone is, don't have sex drunk. So in conclusion, the SANE nurse is a challenging but rewarding nursing specialty. It's a major contributor to the health of the community. It requires flexibility and open-mindedness, because you never know what you're going to run into. You need to have patience and compassion, and if you're getting into it for the money, you probably shouldn't. I hope that you enjoyed this presentation and found it to be informative, and thank you for watching.